The World Health Organization defines healthcare as overall maintenance and solution to the health needs of a person, family, or community. It is a system that addresses these health needs are fulfilled through prevention, treatment, rehabilitation, and palliative care. WHO states that the system needs financial stability, well-trained human resources, along with proper salary, proper information, and proper maintenance of up-to-date facilities to be able to deliver quality services, medicine, and researches. President Duterte signed R.A. 11,223 or the Universal Health Care Act into law last February 20, 2019. The Philippine UHC law presents health system reforms necessary to expand financial protection and access to health services to all Filipinos. This landmark legislation adopts a whole-of-system, whole-of-government, whole-of-society, people-centered approach to improve overall health system performance. What can the Filipinos expect from this UHC law? All Filipinos are covered. Every single Filipino citizen is automatically enrolled into the newly created National Health Insurance Program, NHIP. Citizens will not need to present any PhilHealth ID to avail of these benefits. It is not completely free. Contrary to what some people may think, UHC does not mean every single health expense will be made free. As a patient, that means that if you're admitted in a hospital you can expect regular meal, a bed in a shared room with fan ventilation, and a shared toilet and bath to be covered. It will no longer be free when one wants to stay in a hospital room offering private accommodation, air conditioning, telephone, television, and meal choices, among others. PhilHealth will become the national purchaser of health goods and services. This means that PhilHealth will be in charge of paying health care providers like hospitals and clinics for services given to Filipinos. DOH will still be in charge of population-based health services. DOH is still in charge of delivering health services that covers entire populations. Health systems will become city-wide and province-wide. Provinces and highly urbanized cities will now be in charge of overseeing health services in areas as opposed to the current setup where municipalities are tasked with managing their own health centers. Return service in the public health sector. Graduates of health and health-related courses who received government-funded scholarships will be required to work in the public health sector for at least 3 full years. This will address the need for health workers across the country.
Created using Powtoon.
Now that we know what UHC is, the bigger question is, will it work? Universal healthcare can be determined by 3 critical dimensions: who is covered, what services are covered, and how much of the cost is covered. Think of a box. To achieve UHC, the box must be filled to the brim. The length represents the percentage of the population covered by universal healthcare. The width denotes which services are offered and made available and accessible. The depth is the proportion of costs covered. Universal healthcare is meant to benefit everyone, rich or poor, insofar as health is a basic human right. However, even if everyone is covered, universal healthcare is ineffectual if only limited services are offered. Will common disorders such as diabetes and hypertension be covered? How about severe or catastrophic illnesses like cancer? Universal health coverage is useless if people continue to spend a bulk of their income on diagnostics, medications, and hospitalizations. Although the government can pay for a portion of the cost from sin tax and increase in PhilHealth collections, it is not enough with the population increasing and growing older. What does the box look like now? Everyone is covered since the law was signed. There is no update from implementation sites on services. Due to the pandemic, the budget is insufficient.
Created using Powtoon. Powtoon.